I'm Rhonda Hodnett, the Child Welfare Director of DCFS. You're watching a training video that is part of a project to help children all across Louisiana who are involved with DCFS. You're going to hear about a new screening instrument that will help catch trauma-related problems in children and teenagers. You will also learn about the best ways to help kids with those problems, with better methods to detect the impact of trauma and training to provide evidence-based treatment for traumatic stress. This project is going to make a tremendous impact in the lives of these children.
The Federal Administration of Children, Youth, and Families is always looking for ways to improve the programs that provide services to children in foster care. One of these ways is to implement evidence-based practices to recognize and treat the effects of psychological trauma for these children. In 2012, Louisiana was one of 9 states to receive an award to implement new practices. Over the next 4 years, in partnership with the Department of Children and Family Services and stakeholders in every region, we will implement a series of step-by-step changes. Our first goal is to get everybody on the same page to understand the prevalence and impact of trauma and how it affects children psychologically. The next step will be to use standardized screens to detect traumatic experiences and trauma-related behavioral and emotional problems. The third step will be to work with community clinicians to provide evidence-based treatment.
When I was about 2 years old, I was in the custody of my biological mother. The major event that occurred in her house was that she had decided to place me in a tub of hot scalding water. I suffered third-degree burns of 43% of my body. They placed me in the custody of foster care. About a year and a half into it, I met my nurse, Lenore, and she was the one who decided to take me in her home, and I became her son, and I've been her son since then. I haven't had any type of therapy when I was a younger kid. I only had maybe 2 or 3 therapy sessions when I was like 12, but it was more regarding like burns and dealing with like how to deal with people regarding my burns, but not really my trauma as a child.
As a result of this project, we expect to more accurately identify children who have experienced trauma and need treatment. We also expect that these children will get more effective treatment that will result in better long-term outcomes. This will lead to more stable placements and fewer behavior problems. This video is also intended for the many stakeholders who are a part of the child welfare system. You may be a foster parent, teacher, therapist, doctor, or lawyer. It's important that every key player in these children's lives understands trauma and its impact.
What is trauma? In terms of mental health, trauma has a specific definition. Trauma is defined as an experience that is perceived as life-threatening or a severe threat to a person's body. These include sexual abuse, physical abuse, witnessing domestic violence, motor vehicle collisions, burns, dog bites, disasters, and medical procedures. Trauma is common. In one of the largest studies ever conducted in the United States, researchers from Duke University found that more than 2/3 of all children had experienced at least one life-threatening traumatic event by the age of 16 years. And of those who experienced at least one trauma, 38% had experienced more than one trauma. This is relevant when screening for trauma because it's important to ask about all traumatic experiences.
In the first month after life-threatening trauma, nearly 100% of people will have symptoms that look like post-traumatic stress disorder, or PTSD. We have really good research, however, that shows that most people are resilient. After about 1 month or so, these symptoms go away for about 70% of people, and they have no enduring emotional problems afterwards. The group we're concerned about is the 30% who, for whatever reasons, are vulnerable to develop PTSD. These individuals have tremendous problems. They have severe impairments in their ability to function, and they often suffer in silence because they want to avoid remembering, and nobody asks them the right questions to get them the help they need.
On the outside, a lot of people see me as this bright, happy kid, and a lot of times when I tell them about some of the things that happened to me, because a lot of times I'm willing to tell you what happened, but I won't tell you how I feel about it, because a lot of times I don't think I can handle if I'm truly honest with people about how I feel. about it. So I'll just tell them like I'm cool with it now or something like that. I'll just like throw it off.
In the official definition of PTSD, there are 17 possible symptoms. These are divided into 3 types. The first type consists of 5 re-experiencing symptoms: intrusive and distressing recollections of the event, flashbacks and freezing, nightmares, psychological distress at reminders, physiological distress at reminders. The second type is 7 numbing and avoidance symptoms: restricted range of affect, loss of interest in usual activities, sense of a foreshortened future, detachment or estrangement from others, avoidance of thoughts, feelings, or conversations associated with the event, avoidance of people, places, or things associated with the event. The third type is 5 increased arousal symptoms: difficulty concentrating, difficulty sleeping, irritability or outbursts of anger, exaggerated startle response, hypervigilance.
A diagnosis of PTSD is made by a licensed clinician. However, before a child sees a clinician, we can gain information about PTSD reactions and their severity that will be helpful for treatment. The best way to measure the severity of PTSD reactions is to rate the severity of each symptom on a number scale, and then add up these numbers for a single total score. This is how we're going to ask youth and caregivers to rate PTSD in this project.
In the next video, we will introduce you to the new screening measure being implemented, the TBH, or Traumatic Behavioral Health Assessment.